Hello everyone, I am Vrushali Khandare. I am from first year Department of Pharmacology SKB COP We will discuss about protozoal infection and its treatment. Protozoal infection introduction. Protozoal infection are parasitic disease caused by organism formerly classified in the kingdom Protozoa. They are usually contracted by either an insect, an insect vector, or by contact with an infected substance. This is an infection caused by insect or insect vector, or also caused by the infected substance. Protozoa infections are responsible for diseases that affect many different types of organisms. Not only the humans, it also affects the plants, animals, and some other organisms like marine life. The protozoal infection involves amoebiasis, giardiasis, trichomoniasis, and leishmaniasis. They transmitted by insect vector or directly from other mammalian. The protozoa multiply rapidly in host cell. For the treatment of protozoal infection, the effective vaccines are unavailable. Hence, chemotherapy play an important role in the treatment of protozoal infection and reduce its transmission. The immune system also play a crucial role in protecting of protozoal infection. The first protozoal infection is amoebiasis. Amoebiasis, also known as amoebic dysentery, is an infection caused by entamoeba histolytica. The amoebiasis is a common infection of human gastrointestinal tract. The entamoeba histolytica mainly target the gastrointestinal tract. This infection is caused due to the administration or ingestion of contaminated food and water. The symptoms are more common. The amoebiasis can present with no, mild or severe symptoms. The symptoms are abdominal pain, diarrhea, vomiting, bloody diarrhea. The life cycle of entamoeba histolytica. First of all, cyst. Cyst is a amoebic content. It gets ingested in the human by contaminated food or water. After ingestion into the body, the excision can be takes place in small intestine. After excision in small intestine, the trophozoites get releases into small intestine. After the incystation in small intestine, the incystation can be takes place in colon. From the colon, the fecal material is get excreted. The trophozoites are present in this fecal material, and the excretion of these trophozoites can be takes place through the feces. The trophozoites can cause liver abscess, amoebic colitis, and asymptomatic colonization. The second type of protozoal infection is giardiasis. Giardiasis is caused by flagellated protozoa, that is Giardia lamblia. It is an asymptomatic carrier state absorbed in infected individuals. The giardiasis is mainly related to the malabsorption. Malabsorption manifest by steatorrhea and weight loss may occur. Illness can be life-threatening in individuals. The infection results from ingestion of cyst, most commonly from fecal contamination of food and water. As similar to the amoebiasis, the infection can be caused by contaminated food and water. The intermediated host is not required. Ingested cyst changes into motile trophozoites in the upper small intestine, and it may cause the infection or produce disease. In the diagram, this shows the trophozoites get releases into small intestine, and it can causes the giardiasis. The diagnosis is made by identification of sporozoites in the fecal or in duodenal content. The third protozoal infection is trichomoniasis. The trichomoniasis is a common sexually transmitted infection. It is caused by flagellated protozoa, that is Trichomonas vaginalis. Organisms cause genitourinary tract infection in human host, where it also causes vaginitis in women and uncommonly urethritis in men. This is an infection mainly cause the genitourinary tract infection. This infection is cause both the male and female. In male, it can be urethritis. Urethritis means the inflammation of urethra, and in female, the vaginitis. Vaginitis is the inflammation of vagina. The human genital tract is the only reservoir for this species. The symptoms can include itching in genital area, burning with urination, and pain with sex. Leishmaniasis. Leishmaniasis is also known as Kala Azar. Leishmaniasis are group of protozoal diseases caused by parasite of genus Leishmania and transmitted to the human by the bite of female phlebotomine sandfly mosquito. Leishmaniasis is an infection caused by the biting of mosquito, that is phlebotomine sandfly mosquito. There are three main forms of leishmaniasis, that is visceral, cutaneous and mucocutaneous. The visceral leishmaniasis, also known as Kala Azar, cutaneous is the most common type of infection. The leishmania parasite are transmitted through the bite of female phlebotomine sandflies, which feed on produce eggs and cause infection. The transmission can be caused by infected sandfly mosquito. This mosquito can inject promostigotes in the skin. The promostigotes engulfed by macrophages that is present in human body. The promastigotes get converted into omastigotes. The omastigotes get sucked by the sandfly mosquito, and it is sucked from the infected human to cause infection to the uninfected human. The disease affects some poorest people on earth and associated with malnutrition. It also caused due to the population displacement and poor housing. The treatment of protozoal infections. First of all, the drug used in amoebiasis. Classification: tissue amoebicides for both intestinal and extraintestinal amoebiasis. Nitroimidazoles. Examples: metronidazole, tinidazole. Alkaloid derivatives: imetine, dihydroimetine. For extraintestinal amoebiasis, only chloroquine. Second one, luminal amoebicides. It involves amide. Example: diloxanide furoate and nitazoxanide. Second one, 8-hydroxyquinolines. Example: quinidochlor and diiodohydroxyquine. Antibiotics: tetracycline. Metronidazole. Metronidazole is the most common type of drug which is used in the treatment of protozoal infection. The metronidazole active against a wide variety of anaerobic protozoal parasites and anaerobic bacteria. The potent amoebicidal activity against Entamoeba histolytica. Also, it can show the activity against all anaerobic cocci. It is a drug which is commonly used in the treatment of amoebiasis, giardiasis, trichomoniasis. The metronidazole is effective against both anaerobic gram-negative bacilli. Mechanism of action of metronidazole. The metronidazole can show the mechanism of action by inhibiting the nucleic acid synthesis or by disrupting the DNA of microbial cell. The metronidazole is converted to metabolites and DNA. It can cause the DNA fragmentation or DNA disruption, or shows action by inhibiting DNA or nucleic acid synthesis. The drug for trichomoniasis. There are two types of therapy, that is drug use orally. Example: metronidazole 400 mg for 7 days or tinidazole 600 mg for 7 days. Second one, nimorazole 2 gram single dose taken with the meal. Drugs used intravaginally. Diiodohydroquine 200 mg ingested intravaginally for 1 to 2 weeks. Natamycin 25 mg nightly intravaginal application for 10 days. The drugs for leishmaniasis or Kala Azar. The sodium stibogluconate is commonly used in the treatment of leishmaniasis. It acts through by blocking glycolytic and fatty acid oxidation pathway, rapidly absorbed through intramuscular injection. Amphotericin B. It is a highly effective and cure more than 90% of infections. The amphotericin B is a drug which is commonly used for the treatment of protozoal infections and as well as bacterial infection. This is a drug of choice for antimonial cases. Thank you.